Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see some questions from renal system. We will see the questions one by one. First question, following kidney transplantation, cyclosporine is prescribed for a client. Which laboratory result would indicate an adverse effect from the use of this medication? First option, decrease creatinine level. Second option, decrease hemoglobin level. Third option, elevated blood urea nitrogen. And option D, decrease white blood cells. This is our questions and options. So after kidney transplantation, cyclosporine is prescribed for the patient. So while giving cyclosporine, which laboratory result would indicate an adverse effect from the use of this cyclosporine? We saw the options here. What is the action of cyclosporine? We have to know. Cyclosporine is an immunosuppressive agent used to treat organ rejection post-transplantation. So after kidney transplantation, cyclosporine is given to the patient as an immunosuppressive agent to prevent organ rejection. Here, while giving cyclosporine to the patient, there is a chance of nephrotoxicity. Okay, nephrotoxicity is evaluated by monitoring for elevated blood urea nitrogen and serum creatinine level. So, serum creatinine level and blood urea nitrogen will be elevated if nephrotoxicity occurs to the patient. So, we have to we have to check the nephrotoxicity of the patient. But how we will check? By blood urea nitrogen and serum creatinine level. So our option C is correct answer, elevated blood urea nitrogen. Option first, decrease serum creatinine level. So decrease serum creatinine is wrong. If it is increased means it is correct. Okay. So elevated serum creatinine level and elevated blood urea nitrogen indicate nephrotoxicity. So this is the correct answer, option C. Second question, a nurse is providing dietary instruction to a client who has been prescribed cyclosporine. Which food item would the nurse instruct the client to avoid? First option, red meats. Option B, orange juice. Option C, grapefruit juice. Option D, green leafy vegetables. This is our question and option. So a patient is on cyclosporine and as a nurse, which food item would the patient can avoid while taking cyclosporine? So our options are red meat, orange juice, grapefruit juice and green leafy vegetable. So while taking cyclosporine, we have to avoid grapefruit juice to the patient. Why means a compound present in the grapefruit juice inhibits the metabolism of cyclosporine. So the compound which present in this grape juice can inhibit the metabolism of cyclosporine. So consumption of grape juice can rise cyclosporine level. Once the cyclosporine level will be increased, there is a chance of toxicity, that is nephrotoxicity. If the nephrotoxicity occurs, there is a chance of increased blood urea nitrogen and serum creatinine level. So in order to avoid that, we should tell the patient to avoid grapefruit juice while taking cyclosporine. Option C, grapefruit juice is correct answer. Third question, a client complains of fever, perineal pain and dysuria. To assess whether the client's problem is related to bacterial prostatitis, the nurse would look at the result of prostate examination, which should reveal that prostate gland is softened and swollen. Option B, reddened, softened and boggy. Option C, tender and edematous with ecchymosis. And option D, tender, indurated and warm to touch. Here patient is complaining that patient have fever, perineal pain and dysuria. So the nurse is expecting that maybe it is a bacterial prostatitis. So to confirm that, she is checking the prostate examination result. What she can expect from here? Okay, that is the question. So prostatitis means it's an inflammation or swelling of the prostate gland. The gland with prostatitis may have swollen and tender prostate gland that is also warm to touch, firm and indurated. So if the patient is having prostatitis means the prostate gland will be swollen, tender and warm to touch, firm and indurated. And also systemic symptoms include fever, chills and perineal and low back pain to the patient, and also signs of urinary tract infection can occur to the patient. So here our option D, tender, indurated and warm to touch. If it is there in the examination result, so nurse can suspect that it is a bacterial prostatitis. Here we have to know the signs and symptoms of prostatitis, then only we can answer this question. Next question, fourth question. A client with acute renal failure has a serum potassium level of 6 milliequivalent per liter. The nurse would plan which of the following as a priority action? Option A, check the sodium level. Option B, place the client on a cardiac monitor. Option C, encourage to increase vegetables in the diet. Option D, allow an extra 500 ml of fluid intake to dilute the electrolyte concentration. This is our questions and options. Here, client with acute renal failure has serum potassium level is 6. If we know normal serum potassium level, then we can answer this question easily. What is the normal serum potassium level? It is 3.5 to 5.5 milliequivalent per liter. That is the normal serum potassium level. So here it is 6 milliequivalent per liter. That is hyperkalemia is for the patient. So what is the priority nursing action over here? The client with hyperkalemia is at the risk of developing cardiac arrhythmia and cardiac arrest. So, as a nurse, immediately we should place the patient on a cardiac monitor. Option B, place the client on a cardiac monitor is the correct answer. Why? There is a risk of developing cardiac dysarrhythmia and cardiac arrest. And another one option D, allow an extra 500 ml of fluid intake to dilute electrolyte concentration. That is very wrong, because we should not allow the patient to take extra fluid. It may cause fluid overload in case of renal failure. And also encourage to increase vegetable diet. These vegetables also provide serum potassium to the patient. And also check the serum sodium level. First option, serum sodium. As a nurse, we should check the serum sodium level, because sodium is another electrolyte commonly checked along with potassium level. So serum sodium also we have to check, but the priority nursing action over here is place the client on a cardiac monitor. Option B is correct. And the next question number 5. The client arrives at the emergency department with complaints of low abdominal pain and hematuria. The nurse next asks the client to determine the history of pyelonephritis, glomerulonephritis, trauma to the bladder or abdomen, and option D, renal cancer in the client. This is our question and options. Here, then a client arrives at the emergency department with the complaints of low abdominal pain and hematuria. Hematuria means it is a blood in the urine. So patient complains of abdominal pain and hematuria. So nurse next asks the client to determine the history of. So what history she can ask to the patient, that is the question. So pyelonephritis and glomerulonephritis, it will not come. Why means, and this it is an inflammatory condition. So pyelonephritis means it is an inflammation of the kidney, and glomerulonephritis means inflammation of tiny filters inside the kidney. So it will not come over here. And nurse can ask, that is bladder trauma or injury to abdomen. That nurse can ask the patient, that is bladder trauma or injury should be considered for abdominal pain and hematuria for the patient. So she can ask there is any injury to the bladder or abdomen, that we can ask to the patient. So option C, trauma to the bladder or abdomen is correct over here. And renal cancer in the client's family will not come over here. So pyelonephritis, glomerular nephritis and renal cancer in the family, client's family will not come. We can ask to the patient there is any trauma to the bladder or abdomen is there, that we can ask to the patient.